It is becoming clearer how this new phase of the pandemic, driven by the fast-spreading variants, is changing the game in Canada. Over 15,000 cases of variants of concern have now been reported across the country. The B117 strain, first identified in Britain, accounts for over 90% of them. Cases of the P1 variant, that was the one first detected in Brazil, jumped from about 460 a week ago to over 857 this week. And younger people keep getting sick and ending up in critical care. Ontario reported over 3,000 new COVID cases today. 63% are variants of concern, and a record number of people are now in intensive care, 510, up from 387 last week. Toronto isn't waiting for the province to act. It is sending students back to remote learning. So are Peel Region and Guelph. A number of public health officers and ICU doctors are asking for a strict stay-at-home order. Premier Doug Ford isn't ready to do that yet.
This is moving day by day, by hour. We're going to have further restrictions moving forward very, very quickly.
If there is one thing we have learned in this last year, it is that hesitation and half measures allow the virus to win. Eric Sorensen has our top story tonight.
If Toronto is the country's COVID hotspot, then a scene like this makes no sense. People clustering in malls, shopping for non-essentials.
It was absolutely jam-packed, and I truly was hoping that, people wouldn't be going in there.
Ontario's premier, feeling besieged amid demands that he do more with vaccines and lockdowns, suggested further restrictions are coming for areas like Toronto.
When you have an inferno going on somewhere, you have to turn the hoses there.
In fact, school boards in Toronto, the largest in the country, will shut down to in-person teaching tomorrow and go to online learning. At least 2 other school boards are also moving online. It didn't happen fast enough for one COVID biostatistician who already took his child out of school.
My 12-year-old son is learning from home. He was learning from home last week. Right now, we have a lockdown that is noticeably weaker than the January one, and yet we're dealing with a variant which is a lot more transmissible.
COVID variants now make up the majority of cases in Ontario. In Toronto alone, there are more than 160 active COVID outbreaks. The largest number in schools, where there are more than 50 outbreaks. Another 35 in childcare centres. And there are 47 outbreaks in community and workplace settings, including offices, factories, and grocery stores. Many are young, essential workers who are getting sick but won't qualify for vaccines for several more weeks.
I'm definitely seeing people coming from these workplaces that are essentially high density, they're essential, and many of the people that I'm seeing are infecting, unfortunately, household members.
In Ontario, the curves are troubling. Hospitalizations have turned sharply higher again, and the number of deaths has also been bending upward once more. The Ontario Medical Association says what's needed right now is a more stringent government stay-at-home order.
And what that means, I know no one wants to hear it, is that people should only leave their homes for essential businesses, medical appointments, groceries, those kinds of things.
Medical officers of health in Toronto, Peel and Ottawa have specifically chimed in for stay-at-home orders, and provincial public health officials are signaling that new restrictions could come as early as tomorrow in the hot zones that are asking for them. Eric Sorensen, Global News, Toronto.